framework was designed by the Health Foundation, and we as NHS Borders saw it as an opportunity to really look at how we look at safety as an organisation. So the framework looks at 5 dimensions of safety. It looks at harm in the past, it looks how reliable our systems are today, it looks at how safe is care right today as we're speaking. It looks at how safe will care be in the future, and it looks at how we're learning and improving. NHS Borders is testing the framework at 2 levels. The first is ward to board level. We're also testing it across a pathway for frail elderly patients. What we're hoping to achieve is greater consistency in the way that we look at safety.
What the framework does is it actually helps us think differently and is allow us to have different conversations at different levels, whether it be at ward level through their safety huddles and safety briefs in the morning, the hospital safety brief, or through to actually more scheduled meetings. We can ensure that everything we do every day for our patients and for our staff is focused on the same thing.
I think we can use it for more than just patient safety issues in many respects. And I think it allows and provides a very neat framework and toolkit that improves my ability as a general manager to be more effective and more efficient.
The safety huddles, I found it really beneficial because what it gives me the temperature of the hospital. And listening to what's actually happening from the ward's perspective is a key thing for me, and the staff are feeling confident bringing their issues to this forum, sharing it with others, having a wider insight into what's happening right from the point of the patient entering the hospital right through to the discharging patients. And actually the staff having confidence to say, actually we're not safe. So we identify somebody to support that person in the ward.
We start the safety brief at 7:30 in the morning and 7:30 at night. We're looking sort of back, we're looking at what we're doing today, and we're looking at how we might plan for the future. And I think it's things we've always done, but perhaps the framework just makes it a little bit more concise and a little bit more constructive.
One of the important things is to make sure that for the patient, the pathway, the experience that they have as they come into hospital from primary care through secondary care and back out into the community is one that we can reliably guarantee will keep them safe and make that transition as smooth and seamless as possible. We're looking to gather quite a suite of data, often quite high level data, to improve what we do and prevent such events from occurring. The frailty pathway is about measuring how we get it right each time, every time, for each individual. So marrying those two together so we've got reliability alongside individuality.
It's given us an opportunity to really promote the use of data over time rather than looking at single data points, and it's also allowed us to map the use of data across the 5 dimensions of the framework. So what we were doing before is probably looking at those data sources in isolation of each other, so not necessarily triangulating the data and then predicting ahead to the future.
So the data previously wasn't as robust. It was in different places. It was more assumptions more than anything. And with our model now, this is actually the information that the wards have got at this moment in time, so it's real time.
What the framework's allowing us to do is to actually look at that data with different eyes, with a safety focus, but actually looking at the different components, whether it's something affected by a system or a process, what the human factors are in it, and how we actually then look at it in different ways to see what is it showing us, what are we learning, what do we maybe need to do differently.
There's absolutely lots of learning for NHS Scotland in using the framework. I think it provides an opportunity to streamline the national improvement programmes that we're focusing on, and to streamline the measures that we look at around quality and safety. So there's definitely merit in doing more work nationally.